Hello, had some technical difficulties. Oh my God, it's Dr. Melva, your board certified radiation oncologist. Welcome to this live broadcast. I'm broadcasting live from Chesapeake, Virginia on today, July 27th at about 6:33 p.m. in the evening. Hope everyone's doing well today. Please like and share. Sharing is caring. Today we are going to be talking about receiving a diagnosis of cancer and getting other news about your diagnosis and test results. So come on into the broadcast. We'll wait about 30 seconds and then we'll begin. Hello, welcome to the broadcast. Welcome to the broadcast. This is Dr. Melva. We'll be starting in about 30 seconds. All right, so we'll go ahead and get started. That was probably 15 seconds. I'm Dr. Melva, your board certified radiation oncologist. I help people that have been diagnosed with cancer through my community cancer centers, my speaking and programs. I help them to take charge of their life and live in spite of the diagnosis of cancer. You can follow me on all social media channels at Dr. D-O-C-T-O-R Melva, M-E-L-V-A. So today we're talking about a diagnosis of cancer and what that means, and receiving information. So this was on my heart today to share for a few reasons. One, I had to deliver a lot of bad news this week. A lot. It's never easy to do, but it has to be done. And there was a point in the week when I sat and I wondered if I was the first person that had ever taken the time to sit down with the families and explain what it meant to have cancer. Most of the common questions that I get are, is it bad? What stage is it? These are all common questions I get. Welcome to the broadcast. Welcome to the broadcast. Come on in. Please share the broadcast. Anyone who would like to know this information. I'm Dr. Melva, for those of you just joining me for the first time. Today we're talking about diagnosis of cancer and delivering and getting news. So this week I had to deliver a lot of bad news. It's never easy, but it has to be done. But several times I had to stop and pause and say, is this the first time that someone has had this conversation with this family? So here are a few tips that I want to give you if you were recently diagnosed with cancer, or you know someone who is going through and getting tests, there's concern of a cancer diagnosis. Number one, it is your right to ask that the people that you care and love about, that you may want to be there, are there with you before you get the information. Okay, so let me explain that a little bit. You don't have to get results of tests, get updates about your condition or any test unless you are ready to receive the information. And for a lot of people, that means having a support system there with you, which could be a friend, a family member, a spouse, a child. That's your right, okay? So you need to figure out who you want to be there with you when you find out the news, or if you'd like to be there yourself. So number one, hey Tara, thanks for joining the broadcast. Please share, sharing is caring. So number one, make sure that you have a family member there, or whoever it is you want when you're receiving the information, okay? Number two, thank you. Number two tip I have for you is that make sure that you understand the information. Before you understand the information, make sure that you have an idea before you see your doctor or your healthcare practitioner of how you want to receive the information. Everyone doesn't want to know all the details of what's wrong, what we found on the scan, to see images or pictures. So decide, what type of patient will you be? Are you someone where it would help you if the doctor sat down with you and showed you the CT scan or the PET CT scan or your x-ray? Or are you someone who would just rather not see it because you don't need to see it? You just want to know what's the next step to live, for cure, or for pain control, whatever it is you're going for. So decide what type of person you are and what information you need and how you want it, because you are in charge of how you receive that, okay? So number one, make sure that you ask or you decide who you want to be there when you're hearing news, whether that's bad news or updates or learning of a diagnosis of cancer for the first time. Number 2, decide how much and what type of information you want, okay? Welcome to the broadcast. Welcome to the broadcast. And number 3, what's number 3? If I could sum this up, because I probably have about 10 tips on this. Number 3, let's go to the questions that I normally get. Is it bad? Okay, this is a really, really, really tough question. Is it bad, and what stage is it? Everyone doesn't understand what stages mean, unless you relate it to someone you know who's been diagnosed with cancer and what stage they have. It's all related to what you know. So a lot of people say, will radiation make me throw up? Hey, Michael Holloman, thanks for joining the broadcast. Please share. Sharing is caring. If there are other people who you think this information could help, thanks for joining the broadcast. So let's go back to, is it bad? Okay, and what stage is it? So we relate to what we know. So for one person, a diagnosis of cancer is bad. To someone else, it's not as bad as what they were expecting. Does that make sense? Does that make sense? Thank you for that, Michael. Thank you. So you have to understand what bad means to get an answer to that question. And what stage is it? All cancers are very different. So, hey, Jerissa Barry, Dr. Barry, thanks for joining. So all cancers are different. So a stage 2 or stage 4, depending on what type of cancer it is, may not have the same result as far as how long you'll live, how you'll feel, what your quality of life will be in. So when you ask about the stage and you ask about if it's bad, I want you to think about a couple other things that go with that. One, what's bad to you? What's important to you? So these are all things that I want you just to think about, as I had to deliver a lot of bad news this week, and I realized that I was the first person that sat down with a lot of these families to explain these things. And as I answered the questions of, hey, Bridget Barnum Bowen, how you doing? Thanks for joining the broadcast. Please share. Share is caring. So today, I'm Dr. Melva. For those of you who just joined, I'm going over getting a diagnosis of cancer or any updates to your condition. So a few tips I had, I'll kind of sum it up. Thank you for that. Thank you for that. And then I'll open it up for questions. So 1, understanding what type of person you are, who you want to be with you when you get the information. It is your right to have whoever it is you want to be there before you have gotten the information. So if that's a family, a friend, or spouse, ask that you have them in the room before you get any results. Not one person deserves to be by themselves when they get information. Or the other thing that happens that just really upsets me is when information is given and no one asks how they want the information. So number two, thank you for sharing. Thank you for sharing. Number 2 is, what type of person are you? What type of information do you want? Do you want the doctor to sit down with you and show you the scans if there's something that's found, the PET CT scans, the chest x-ray scans, or would you rather just not see it and know what's next? So decide that. Think about that. What will help you? Do you need your doctor to draw pictures? Like anyone who's seen me, you know I'm going to be drawn on a folder, on the table, because that I see how that helps my patients, a lot of my patients. So if you need a picture, ask for a picture. The doctor doesn't have to be an artist, just ask for a picture. And number 3, make sure that when you ask the questions of is it bad or what stage it is, that you have some idea of what bad is to you. Because a stage 4 in some disease isn't as bad as maybe a stage 2 in other diseases. It's very confusing. So it's important that you ask. So those are my tips. Thank you so much for joining everyone in the broadcast. Let me go back and read some questions. Good, Dr. Pinn-Bingham. Go, Dr. Pinn-Bingham. Thanks, Tara Dunlow. Hey, Tara Dunlow. Michael Holloman. Hey, I'll certainly share. Thank you for that, Michael. Dr. Jerissa Barry, hey Doc, hey Dr. Barry, Bridget, hey Dr. Melva, hey Bridget, Margie Kennedy, welcome Margie, blessings from California, thank you. So are there any questions that anyone has? I'm happy to address them in regards to what we just talked about as far as diagnosis of cancer, receiving news, and updates. Again, for those of you who just joined, I'm Dr. Melva, your board certified radiation oncologist. Nisi Hines, hey doctor. Hi Nisi, thanks for joining. Please share. Sharing is caring. Thank you so much for sharing, Nisi Hines. Thank you for sharing. Michael Holloman, I appreciate that. So if there are any questions that I can answer about what we talked about today or any future topics you'd like to hear about, please let me know. Again, I'm Dr. Melva, and you can find me on all social media channels at Dr. Melva, D-O-C-T-O-R, Melva, M-E-L-V-A. All right, Bridget says, can some cancers be cured by a diet change? So Bridget, I wish that was 100% to everything where you didn't need radiation or chemo or surgery. I certainly think that your risk of cancer occurrence or reoccurrence where it comes back decreases by a diet change. As far as being cured, that's difficult for me to answer. I think with God, amazing things can happen, and I've seen some things, but in general, I would say that focusing on nutrition, which I'm a big proponent on, is good for getting the cancer to not come back and preventing it from coming. So I hope that helps answer your question, Bridget. Thanks so much for asking. Thank you for that. Thank you for the love. Any other questions? Any other questions? We have just a few minutes. I talk really fast. I have to slow down. I'm just excited to share this information because it was a tough week, but I think I made some good out of some really bad situations because I took the time to explain and answer with my patients about what was going on. And that's important, and I want to empower you to know that you can do that. No matter what cancer center you're in or hospital, it is your right to get information about your body and your diagnosis or updates with what's going on the way you want to get it and the way that you and your family can understand it and that you feel cared about and supported. All right, friends, thank you so much for joining the broadcast today. And again, it is July 27th, about 6:45 p.m. from Chesapeake, Virginia. And Michael Holloman says, great information for patients, proves that your heart is in what you do as a physician. Thank you so much for that, Michael Holloman. We know we love you and we miss you in a husky. We need to see you back. Nisi Hines says, is it true that when diagnosed with cancer and surgery is performed, does it make it spread faster? So Nisi, I get this question a lot. Thanks for joining the broadcast and for your question. So having surgery does not necessarily make a cancer spread faster. There's some cancers that what you call drop metastasis, where sometimes at the surgery site, it's very rare, but if the needle is going into the tissue, I need to draw. I have to draw to explain things. I need to get a whiteboard. I'll work on that. But when you're sampling the tissue and you're pulling the needle out, sometimes just in that area, I have seen that happen. You see it more in melanoma, really aggressive type melanomas, where at the scar site, sometimes you can see disease at the scar. Occasionally I've seen it for some lung cancers, but it's definitely, when you weigh what's better, a pro versus a con, if you can have your cancer cured by having a surgery first or surgery to find out what type of cancer you have, it makes more sense to have the surgery. So it's very minimal, and it usually is more common. The question I'm answering is it true when diagnosed with cancer and surgery is performed, does it make it spread faster? It's very rare. Yes, it can happen, but it's not common. Thank you for that question. I hope that answers that, Nisi. Hi, Anna Turner. Thank you so much for joining the broadcast today. Thank you for joining. Please share. Sharing is caring. Okay, friends, I'm going to wrap it up if there are no other questions. Again, I'm Dr. Melva, your board certified radiation oncologist. Please follow me on all social media channels at Dr. D-O-C-T-O-R Melva, M-E-L-V-A. Until next time, have a good evening. Thank you.